Hello everyone, I am Baishala Bansuan and I will be discussing the orgasmic disorder, sexual pain disorders, implementation, providing sexual health teaching, sex education, teaching self-elimination, responsible sexual behavior, STI prevention, and avoiding sexual harassment and abuse. So let's start with the orgasmic disorder. First, what is orgasmic disorder? Orgasmic disorder is a lack of or delay in sexual climax or orgasm that is infrequent or much less intense even though sexual stimulation is sufficient and the woman is sexually aroused mentally and emotionally. The more accurate and objective term is female orgasmic disorder, which simply means that the sexual response stops before orgasm occurs. Pre-orgasmic women have never experienced an orgasm. Compounding the orgasmic difficulty is the associated anxiety. But some men suffer from male orgasmic disorder. Men with this disorder can maintain an erection for long periods, an hour or more, but have extreme difficulty ejaculating, referred to as retarded ejaculation. In heterosexual intercourse, the difficulty may be limited to ejaculation in the vagina. Some men ejaculate after self-stimulation or manual or oral stimulation by the partner, whereas others have great difficulty ejaculating with any type of stimulation. And rapid ejaculation is the one of the most common sexual dysfunction among men. Both men and women can experience dyspareunia, where it is a pain during or immediately after intercourse. It is associated with many psychological causes, especially those that inhibit lubrication, skin irritation, vaginal infections, estrogen deficiency, and use of medication that drive vaginal secretion can cause women to experience discomfort with intercourse. Pelvic disorders such as infection, lesions, endometriosis, scar tissue, or tumors can cause painful intercourse. Similarly, in males, infection or inflammation of the glans penis or the other genitourinary organs can cause pain with intercourse. Also, some contraceptive foams, creams, sponges, or latex production can irritate either the vagina or penis. Vaginismus is the involuntary spasm of the outer one-third of the vaginal muscle, making penetration of the vagina painful and sometimes impossible. Vulvodynia is constant, unremitting burning that is localized to the vulva with an acute onset. Vestibulitis causes severe pain only on touch or attempted vaginal entry. Couples who define their relationship in terms of rigid, unequal power, and gender roles may have difficulty negotiating and compromising about sexual issues. Not infrequently, the person with the least power feels helpless and dissatisfied with the sexual interchanges. Lack of intimacy or feeling of connectedness is understandably related to satisfaction problems. Next is implementing. The interventions the nurses selects are based on the data obtained from the client and the identified nursing diagnoses. Many interventions are directed at providing information about sexual health and counseling for altered sexual function. Nurses require 6 basic skills to help clients in the area of sexuality. First is self-knowledge and comfort with their own sexuality. Second, acceptance of sexuality is an important area for nursing intervention and a willingness to work with clients who express their sexuality in a variety of ways. Third, knowledge of sexual growth and development throughout the life cycle. Fourth, knowledge of basic sexuality, including how certain health problems and treatment may affect sexuality and sexual functions, which intervention facilitate sexual expression and functioning. Fifth is the therapeutic communication skills. And lastly, the ability to recognize needs for all client and family members to have the topic of sexuality introduced not only in written or audiovisual materials but also in a verbal discussion. Next is the providing sexual health teaching. Educating about sexual health is an important component of nursing implementation. Many sexual problems exist because of sexual ignorance. Many others can be prevented with effective sexual health teaching. Example of important areas of teaching are sex education, including self-elimination and responsible sexual behavior. Next is the sex education. The benefits of the Kegel exercises include increased pelvic floor muscle tone, increased vaginal lubrication during sexual arousal, increased sensation during intercourse, increased genital sensitivity, stronger gripping of the base of the penis, earlier postpartum recovery of the pelvic floor muscle, and increased flexibility of episiotomy scars. When clients experience illness or surgery that may alter sexual function, the nurse needs to discuss effect of treatment, example medications, and any changes that needs to be undertaken to ensure safe sex, example position changes or safe time to resume sexual intercourse after a heart attack. Although there is an increasing awareness today of sexuality and sexual functioning, some people still hold certain myths and misconceptions about sexuality. Next is the teaching self-elimination. Breast self-elimination for women and testicular self-elimination for men can play an important role in early detection of disease, resulting in a greater chance of cure and less complex treatment. Although the vast majority of breast cancers in the United States each year occur in women, men with an increased risk of breast cancer due to high estrogen levels or a strong family history of breast cancer should also learn BSE. For BSE, a regular time is best such as 1 week following menstruation, when breast tenderness and fullness caused by fluid retention have subsided, or on the same day of the month for men or postmenopausal women. Next is the responsible sexual behavior. Responsible sexual behavior involves the prevention of STIs, the prevention of unwanted pregnancy, and the avoidance of sexual harassment or abuse. Next is the STI prevention. The prevention of STIs is an essential part of sexual health teaching. Increases in these infections are due to two factors. One, changing sexual morality that has permitted increased sexual activity, and two, an increase in the number of sexual partners. And lastly, avoiding sexual harassment and abuse. Sexual harassment exists when someone in a position of power threatens another person's job or status in exchange for unwanted sexual acts. And this ends my report, so let's move on to the next reporter.